A year into the pandemic, frontline workers say they still don't have enough protective equipment, including N95 masks. COVID-19 intensive care nurse Mary Turner says she still gets just one per shift, instead of the recommended one per patient.
You can't imagine how much we've had to fight for something this basic this past year.
Meantime, U.S. manufacturers like Mike Bowen of Prestige Ameritech say their warehouses are overflowing with masks.
They should only reuse them if there's nothing else, if there's no other choice. But there is a choice. I have millions of respirators. Everyone's saying there's a shortage, yet I am drowning in respirators.
At the start of the pandemic, the U.S. and most of the world were heavily dependent on China for protective gear. The federal government directed U.S. manufacturers to produce more masks, and they did.
In 2019, we sold about 75,000 respirators per month. And currently, we are making 7.2 million respirators per month. And we're on our way to 9.6 million respirators per month.
But Bowen says he has customers for only about half of his output. An Associated Press investigation has found the logistical breakdown is due to federal failures over the past year to coordinate supply chains. Chester Trey Moeller was acting deputy chief of staff at the CDC in the last months of the Trump administration. He says the agency responsible for certifying masks did not do enough to connect healthcare providers with manufacturers.
We have the capacity to get those out to the hospital systems all across the country, and it's just not being done right now. I mean, it's infuriating.
The American Hospital Association says some hospitals in the midst of COVID-19 surges are using the masks faster than the supply chain can replace them. Others are loath to trust masks from unfamiliar suppliers. Turner suspects there's another reason.
I can only deduce that they don't want to spend the money. Our hospital systems are profit over patients, profit over the safety of their staff.
In a statement, Turner's employer, North Memorial Health, said its PPE supply decisions are guided by its commitment to staff and customer safety, and that they need to balance daily use with future needs. Meanwhile, the Federal Emergency Management Agency recently gave Prestige, which works with medical markets, permission to sell its excess masks abroad, but Bowen is reluctant to take that step.
If we had our druthers, it would be to sell here and help America. But when we're in a situation where our warehouse won't hold any more respirators, we're going to have to send them wherever we can.
Turner says hospital workers feel caught in the middle.
It's not like the nurses and the frontline healthcare workers are in it for their own gain. We're in it to save lives. We're in it to save lives. And we shouldn't be penalized because of that.
Alan Breed, Associated Press.